Chronic disease, a disease that persists for a long time. A chronic disease is one lasting 3 months or more, by the definition of the U.S. National Center for Health Statistics. Chronic diseases generally cannot be prevented by vaccines or cured by medication, nor do they just disappear. 88% of Americans over 65 years of age have at least one chronic health condition as of 1998. Health-damaging behaviors, particularly tobacco use, lack of physical activity, and poor eating habits, are major contributors to the leading chronic diseases. Chronic diseases tend to become more common with age. The leading chronic diseases in developed countries include in alphabetical order arthritis, cardiovascular disease such as heart attacks and stroke, cancer such as breast and colon cancer, diabetes, epilepsy and seizures, obesity, and oral health problems. Each of these conditions plague older adults in the U.S. and other developed nations. Arthritis and related conditions are the leading cause of disability in the U.S., affecting nearly 43 million Americans. Although cost-effective interventions are available to reduce the burden of arthritis, they are underused. Regular, moderate exercise offers a host of benefits to people with arthritis by reducing joint pain and stiffness, building strong muscle around the joints, and increasing flexibility and endurance. Cardiovascular disease is a growing concern in the U.S. Heart disease is the nation's leading cause of death. 3 health-related behaviors: tobacco use, lack of physical activity, and poor nutrition contribute markedly to heart disease. Modifying these behaviors is critical for both preventing and controlling heart disease. Modest changes in one or more of these risk factors among the population could have a profound public health impact. Cancer is the second most common cause of death in the U.S. Cancer is largely controllable through prevention, early detection, and treatment. Reducing the nation's cancer burden requires reducing the prevalence of the behavioral and environmental factors that increase cancer risk. It also requires ensuring that cancer screening services and high-quality treatment are available and accessible, particularly to medically underserved populations. Colorectal cancer is the second leading cause of cancer-related deaths in the U.S., accounting for 10% of all cancer deaths. The risk of developing colorectal cancer increases with advancing age. Lack of physical activity, low fruit and vegetable intake, a low-fiber diet, obesity, alcohol consumption, and tobacco use may contribute to the risk for colorectal cancer. 3 screening tools: flexible sigmoidoscopy, colonoscopy, and the fecal occult blood test (FOBT) are widely accepted and used to detect colorectal cancer.